Question 1. The nurse is monitoring a child for bleeding after surgery for removal of a brain tumor. The nurse checks the head dressing for the presence of blood and notes a colorless drainage on the back of the dressing. Which action would the nurse perform immediately? 1. Notify the surgeon. 2. Reinforce the dressing. 3. Document the findings and continue to monitor. 4. Circle the area of drainage and continue to monitor hemorrhage. Answer is option 1. Notify the surgeon. Colorless drainage on the dressing in a child after craniotomy indicates the presence of cerebrospinal fluid and needs to be reported to the surgeon immediately. Options 2, 3, and 4 are not the immediate nursing action because they do not address the need for immediate intervention to prevent complications. Question 2. A child undergoes surgical removal of a brain tumor. During the postoperative period, the nurse notes that the child is restless, the pulse rate is elevated, and the blood pressure has decreased significantly from the baseline value. The nurse suspects that the child is in shock, which is the most appropriate nursing action. 1. Notify the surgeon. 2. Place the child in a supine position. 3. Place the child in Trendelenburg's position. 4. Increase the flow rate of the intravenous fluids. Answer is option 1. Notify the surgeon. In the event of shock, the surgeon is notified immediately. After craniotomy, a child is never placed in the supine or Trendelenburg's position because either position could increase intracranial pressure, ICP, and the risk of bleeding. The head of the bed needs to be elevated. Increasing intravenous fluids can cause an increase in ICP. Question 3. The parent of a 4-year-old child tells the pediatric nurse that the child's abdomen seems to be swollen. During further assessment, the parent tells the nurse that the child is eating well and that the activity level of the child is unchanged. The nurse, suspecting the possibility of Wilms tumor, would plan to avoid which during the physical assessment. 1. Palpating the abdomen for a mass. 2. Assessing the urine for the presence of hematuria. 3. Monitoring the temperature for the presence of fever. 4. Monitoring the blood pressure for the presence of hypertension. Answer is option 1. Palpating the abdomen for a mass. Wilms tumor is the most common intra-abdominal and kidney tumor of childhood. If Wilms tumor is suspected, the tumor mass would not be palpated by the nurse. Excessive manipulation can cause seeding of the tumor and spread of the cancerous cells. Hematuria, fever, and hypertension are clinical manifestations associated with Wilms tumor. Question 4. The nurse provides a teaching session to the nursing staff regarding osteosarcoma. Which statement by a member of the nursing staff indicates a need for further instruction? 1. The femur is the most common site of this sarcoma. 2. The child does not experience pain at the primary tumor site. 3. Limping, if a weight-bearing limb is affected, is a clinical manifestation. 4. The symptoms of the disease in the early stage are almost always attributed to normal growing pains. Answer is option 2. The child does not experience pain at the primary tumor site. Osteosarcoma is the most common bone cancer in children. Cancer usually is found in the metaphysis of long bones, especially in the lower extremities, with most tumors occurring in the femur. Osteosarcoma is manifested clinically by progressive, insidious, and intermittent pain at the tumor site. By the time these children receive medical attention, they may be in considerable pain from the tumor. Options 1, 3, and 4 are accurate regarding osteosarcoma. Question 5. The nurse analyzes the laboratory values of a child with leukemia who is receiving chemotherapy. The nurse notes that the platelet count is 19,500 cubic millimeters, 19.5 by 109 per liter. On the basis of this laboratory result, which intervention would the nurse include in the plan of care? 1. Initiate bleeding precautions. 2. Monitor closely for signs of infection. 3. Monitor the temperature every 4 hours. 4. Initiate protective isolation precautions. Answer is option 1. Initiate bleeding precautions. Leukemia is a malignant increase in the number of leukocytes, usually at an immature stage in the bone marrow. It affects the bone marrow, causing anemia from decreased erythrocytes, infection from neutropenia, and bleeding from decreased platelet production, thrombocytopenia. If a child has a low platelet count, usually less than 50,000 cubic millimeters, 50.0 by 109 per liter, bleeding precautions need to be initiated because of the increased risk of bleeding or hemorrhage. Precautions include limiting activity that could result in head injury, using soft toothbrushes, checking urine and stools for blood, and administering stool softeners to prevent straining with constipation. In addition, suppositories, enemas, and rectal temperatures are avoided. Options 2, 3, and 4 are related to the prevention of infection rather than bleeding. Question 6. The nurse is monitoring a 3-year-old child for signs and symptoms of increased intracranial pressure, ICP, after a craniotomy. The nurse would plan to monitor for which early sign or symptom of increased ICP? 1. Vomiting. 2. Bulging anterior fontanelle. 3. Increasing head circumference. 4. Complaints of a frontal headache. Answer is option 1, vomiting. The brain, although well protected by the solid bony cranium, is highly susceptible to pressure that may accumulate within the enclosure. Volume and pressure must remain constant within the brain. A change in the size of the brain, such as occurs with edema or increased volume of intracranial blood or cerebrospinal fluid without a compensatory change, leads to an increase in ICP, which may be life-threatening. Vomiting, an early sign of increased ICP, can become excessive as pressure builds up and stimulates the medulla in the brainstem, which houses the vomiting center. Children with open fontanelles, posterior fontanelle closes at 2 to 3 months, anterior fontanelle closes at 12 to 18 months, compensate for ICP changes by skull expansion and subsequent bulging fontanelles. When the fontanelles have closed, nausea, excessive vomiting, diplopia, and headaches become pronounced, with headaches becoming more prevalent in older children. Question 7. A 4-year-old child is admitted to the hospital for abdominal pain. The parents report that the child has been pale and excessively tired and is bruising easily. On physical examination, lymphadenopathy and hepatosplenomegaly are noted. Diagnostic studies are being performed because acute lymphocytic leukemia is suspected. The nurse determines that which laboratory result confirms the diagnosis. 1. Lumbar puncture showing no blast cells. 2. Bone marrow biopsy showing blast cells 3. Platelet count of 350,000 cubic millimeters, 350 by 109 per liter. 4. White blood cell count of 4,500 cubic millimeters, 4.5 by 109 per liter. Answer is option 2. Bone marrow biopsy showing blast cells. Leukemia is a malignant increase in the number of leukocytes, usually at an immature stage in the bone marrow. The confirmatory test for leukemia is microscopic examination of bone marrow obtained by bone marrow aspirate and biopsy, which is considered positive if blast cells are present. An altered platelet count occurs as a result of the disease, but also may occur as a result of chemotherapy, and does not confirm the diagnosis. The white blood cell count may be normal, high, or low in leukemia. A lumbar puncture may be done to look for blast cells in the spinal fluid, which would indicate central nervous system disease. Question 8. A 6-year-old child with leukemia is hospitalized and is receiving combination chemotherapy. Laboratory results indicate that the child is neutropenic, and protective isolation procedures are initiated. The grandparent of the child visits and brings a fresh bouquet of flowers picked from the garden and asks the nurse for a vase for the flowers. Which response would the nurse provide to the grandparent? 1. I have a vase in the utility room, and I will get it for you. 2. I will get the vase and wash it well before you put the flowers in it. 3. The flowers from your garden are beautiful, but cannot be placed in the child's room at this time. 4. When you bring the flowers into the room, place them on the bedside stand as far away from the child as possible. Answer is option 3. The flowers from your garden are beautiful, but cannot be placed in the child's room at this time. Leukemia is a malignant increase in the number of leukocytes, usually at an immature stage in the bone marrow. It affects the bone marrow, causing anemia from decreased erythrocytes, infection from neutropenia, and bleeding from decreased platelet production, thrombocytopenia. For a hospitalized neutropenic child, flowers or plants would not be kept in the room because standing water and damp soil harbor Aspergillus and Pseudomonas aeruginosa, to which the child is susceptible. In addition, Fresh fruits and vegetables harbor molds and need to be avoided until the white blood cell count increases. Question 9. A diagnosis of Hodgkin's disease is suspected in a 12-year-old child. Several diagnostic studies are performed to determine the presence of this disease. Which diagnostic test result will confirm the diagnosis of Hodgkin's disease? 1. Elevated vanillomandelic acid urinary levels. 2. The presence of blast cells in the bone marrow. 3. The presence of Epstein-Barr virus in the blood. 4. The presence of Reed-Sternberg cells in the lymph nodes. Answer is option 4. The presence of Reed-Sternberg cells in the lymph nodes. Hodgkin's disease, a type of lymphoma, is a malignancy of the lymph nodes. The presence of giant multinucleated cells, Reed-Sternberg cells, is the classic characteristic of this disease. Elevated levels of vanillomandelic acid in the urine may be found in children with neuroblastoma. The presence of blast cells in the bone marrow indicates leukemia. Epstein-Barr virus is associated with infectious mononucleosis. Question 10. Which specific nursing interventions are implemented in the care of a child with leukemia who is at risk for infection? Select all that apply. 1. Maintain the child in a semi-private room. 2. Reduce exposure to environmental organisms. 3. Use strict aseptic technique for all procedures. 4. Ensure that anyone entering the child's room wears a mask. 5. Apply firm pressure to a needle stick area for at least 10 minutes. Answer is 2, 3, and 4. Leukemia is a malignant increase in the number of leukocytes, usually at an immature stage, in the bone marrow. It affects the bone marrow, causing anemia from decreased erythrocytes, infection from neutropenia, and bleeding from decreased platelet production, thrombocytopenia. A common complication of treatment for leukemia is overwhelming infection secondary to neutropenia. Measures to prevent infection include the use of a private room, strict aseptic technique, restriction of visitors and healthcare personnel with active infection, strict hand washing, ensuring that anyone entering the child's room wears a mask, and reducing exposure to environmental organisms by eliminating raw fruits and vegetables from the diet and fresh flowers from the child's room, and by not leaving standing water in the child's room. Applying firm pressure to a needle stick area for at least 10 minutes is a measure to prevent bleeding.